Hi, I'm Julie Martin, and I will be presenting my Opioid Abuse Prevention and Awareness Program. Opioid addiction is a hidden crisis being faced in the U.S. Such a highly addictive drug can lose many lives in the community. The National Institute of Drug Abuse reports that more than 2 million Americans abuse opioids, and more than 90 Americans die from opioid abuse every day. Opioids are an important icon in the medical field. Having this miracle drug for people at need can quickly turn into someone's addictive nightmare. The brain relieves temporary pleasure when opioids are taken, and people often abuse this. Health issues in our community that relates to opioid abuse is everywhere around us. Our neighbors, classmates, coworkers, and even close friends are always at risk. This abuse is not talked about greatly enough and can be very secretive. Individuals often think this could not happen to me, but most do not understand how addictive opioids are and how many Americans are affected by addiction every day. States such as West Virginia, Kentucky, Ohio, and D.C. have the highest drug abuse rate. The ages of this population reach 18 to 25, but can affect any age group. Most are young adults who are Caucasian, but anyone with past drug experience and those who have been pressured or prescribed drugs for medical reasons are at a high risk. The objective of this program is to provide knowledge about opioid addiction in the community, in order to prevent the growing epidemic to increase any further. To prevent the epidemic of opioid abuse in the community, as well as inform the public on how to reduce the numbers of users in the community, is the overall goal. Ways to help is to develop a program to present the public schools to young adults about the dangers of opioid abuse, and to provide information to patients at risk for those who are prescribed opioids. Overall, talking about dangers of opioid abuse and how to prevent addiction is also a main goal. This 4-year program will schedule and correlate multiple interventions to help implement this program. The goal is to prevent opioid abuse in the future victims and to help those who are struggling. Having interventions and providing knowledge in schools, work environments, town halls, and using propaganda will be the best way to spread information, as well as hosting seminars will help decrease the use in our communities. Okay. A local drug and alcohol rehab center will give the opportunity for participants to undergo a survey. Those who have completed a 90-day program of being sober are accepted into the survey. Patient satisfaction will be recorded in a database on how they felt about the program was conducted and rated factors such as the Likert scale. Random exit interventions can be conducted on patients' approval for a detailed verbal survey. Looking at this budget, it calculated as a 3-year span of a total of $36,089.62 will be needed over a 3-year span. Okay, so by bringing awareness and information to the public on the importance of fixing this epidemic could help the community that is at high risk. Doing actions such as informing the public on the importance of fixing this epidemic could help the community that is at high risk. Doing actions such as informing the public, increasing access to drug testing, and making rehab more costly or cost efficient can greatly reduce this epidemic. Drug abuse continues to grow in the U.S., and it is the media's responsibility to provide adequate information to the public to inform these issues.